So next up, we have, we're going to talk about infertility and fertility.
I'm excited for this topic.
Yes, I am too.
So we have Dr. Tiffanny Jones. Dr. Tiffanny Jones is a board-certified,
reproductive endocrinology and infertility specialist.
Yes, she is all of that. She graduated with her Bachelor of Science degree in biology from UCLA. She attended a master's program at California State University, a Dominguez Hills Master's of Arts degree. Dr. Jones earned her medical degree from Mary Medical College in Nashville, and she completed her residency at LAC and USC Medical Center in Los Angeles, and her fellowship at the Mayo Clinic in Rochester. I just joined Mayo Clinic the other day, so I'm excited. She enjoys all areas of reproductive medicine and has a special interest in fertility preservation. And I quote, "Women want to be settled in their careers and find the perfect mate prior to starting a family. Unfortunate, the older we are, the more difficult it can be to conceive." She has written numerous papers on fertility and is a medical consultant to various media outlets. Let's welcome Dr. Tiffanny Jones.
Hello, Dr. Jones. Can I just say that I am like loving all of the Black Girl Magic? We got these Black women doctors up here. Yes, who are just, making, I love it. It's beautiful.
Absolutely. We're gonna bring on some Latina magic too.
Yes.
We're going to bring on Natalia Green. She is one of our Latina metastatic baddies. She is a first-generation American and a mother of two. Natalia is also a 2018-2019 Living Beyond Breast Cancer Young Advocate, and she is challenging her state representatives to help those affected by breast cancer cover the cost of fertility preservation. Let's welcome Natalia.
Hey, girl. Hey.
Hello. We're so happy to have both of you ladies on here. So we'll start off with this is a basic. Everyone knows that chemotherapy can affect your reproductive system, but there isn't a lot of conversation about how hormone therapy affects your reproductive system. For me personally, it was a conversation my doctors didn't even want to have. They literally told me, let's worry about the cancer first and then babies later. But the problem is that if you don't understand how hormone therapy can affect your reproductive system, then you may not even have the chance to worry about the babies later. So how does chemotherapy, or rather hormone therapy, affect reproductive systems, and what can women do to mitigate those risks?
So one of the most common hormone therapies is tamoxifen, and it is a selective estrogen receptor modulator, which basically means on some of the tissues like breast cancer, for instance, it will take up the receptors and block estrogen's effect. And on hormone-sensitive tumors, it's very important because estrogen is a growth factor. In other tissues, however, it can be stimulatory. So when you talk about endometrial cancer in a postmenopausal woman, tamoxifen can actually increase hyperplasia and lead to cancer.
Wow.
In premenopausal women, that's very unlikely to occur. Because tamoxifen is a very similar drug to some of the other medications that we actually use for fertility, like Clomid, which is another selective estrogen receptor modulator, generally you should be okay as far as fertility with using a medication like that. Lupron is another hormone therapy where it actually is blocking the GnRH receptors in the brain so that you're not releasing or your body's not responding to the hormones that stimulate the ovaries, releasing follicles and eggs every month. So both of them actually can be kind of protective in a way for fertility. The only thing that I really would worry about with tamoxifen is polyps in a premenopausal woman, which can be easily treated with surgery.
Yes. So I know for me, I am on both. Hello. Someone might have like their Facebook playing in the background, maybe. For me, I'm on tamoxifen and Lupron. Tamoxifen, I did have polyp within like the first 6 months on the tamoxifen, but it also can cause changes to your uterus and the lining of your uterus. And with Lupron being kind of induces medical menopause, in some cases, women can go into medical menopause and not come out.
So generally, the Lupron doesn't cause you to go into menopause, but what it can do is mask the effects of the chemotherapy, where if you had never taken Lupron and the chemotherapy that you're on causes a detrimental effect to your ovaries, now you're on Lupron, which is masking that because it's going to make you in menopause while you're taking it. And so when you're stopping it, you didn't realize that the chemotherapy agent actually had caused that effect. But the Lupron in itself, we sometimes give to women to help them prolong their fertility.
Wow.
That's awesome. I know that when I was going through chemo, before I had started chemo, they actually gave me Lupron to what my oncologist said, just to, quiet your ovaries, just in case you want to preserve your fertility. And yeah.
When I tell my patients about Lupron as a way to preserve their fertility, I use the analogy of being out in the woods. It's cold. You only have a blanket with holes in it. And, if you had the choice of nothing or a blanket with holes in it, you would still probably take the blanket with holes in it. And Lupron by no means is going to completely help restore the ovaries, but it is something. And because of the mechanism in quieting the ovaries, hopefully they would be less affected by the chemotherapy agents.
So after a diagnosis, I can probably speak for every woman that's ever been diagnosed, decisions have to be made really fast.
Yeah.
There are times where women are not really given the opportunity to seek consultation about fertility preservation. Do you recommend that women bring their OBGYN into this conversation after a diagnosis? What would be the benefits of slowing down your oncology appointments just so you can get some more thought and more input for fertility preservation if it's important to you?
Yeah. So I think the OB-GYN plays a really, really big role. Generally, we go into OB-GYN because we get to have this long lasting relationship with our patients. So out of all the doctors that we might see as women, the OB-GYN might be the one who the best. And she may have been she or he may have been the one who actually was the one to catch the cancer during an annual exam. So they have a referral base. So they'll know the fertility specialist, they'll know the breast surgeons, they'll know the oncologist. So they, to me, are true patient champions to help you navigate these new waters. And hopefully you have an OB-GYN that you go to because you trust them and because they know you. And having that is so valuable when you have to make these decisions that have been sprung upon you where you don't know what to do. And just like you go to your mom, you go to your friend, and you go to someone you trust, if you have a doctor like your OB-GYN that you trust, they really can be a big support system and helping you navigate these new uncharted waters.
That is awesome. I definitely felt bringing my OBGYN was an advantage to me, especially when my oncologist was so focused on just the cancer. My OB was like, you want to have kids though, let's take a minute. And I know some referrals. But then the next step, once you have those conversations, is there are barriers to even getting for the fertility preservation. So I had 1 month before I was going to start treatment, which means I could only do one cycle of IVF. And with everything else going on, I went to the fertility specialist and found out that fertility preservation would cost $10,000. $10,000. And Natalia, let me turn your mic on. Actually, Ty, you have to unmute yourself. There you go.
I unmute myself. Can you hear me okay?
It was $10,000. And so by the grace of God, they found me a couple of programs. Walgreens was one. Walgreens, they covered the cost of the medicines, but for Walgreens, you can't have started radiation or anything to go into that. And then Live Strong covered like $5,000 when the fertility clinic allowed us to do a down payment not down payment, but a monthly payment for the rest. But that's not a common thing. So with fertility preservation being very important, especially to younger women that are going through breast cancer, Natalia, you are advocating that it is covered by health insurance. Can you tell us about why you took up this sword?
Well, funny, when I was diagnosed with cancer, I was done having kids, but it wasn't until I started getting involved with breast cancer groups that I even knew that fertility preservation was an issue for young people who were diagnosed with cancer. Like, it didn't even cross my mind. And I was blown away about especially for women, the short time frame they have. And as a woman, for some women, I should say, it's really important for them to start families. It's part of who they want to be, and it's the future they're setting up for themselves. And I was really discouraged that so many people really didn't have an opportunity to think about it because they were diagnosed with cancer. Mm-hmm. And then it's not right. I think most cancer survivors can tell you that you really don't start thinking about the impact of what cancer has in your life until after treatment.
Exactly.
So you start thinking about now, like, how am I going to date? How am I going to have a spouse? Am I going to be able to start a family? And I'm only reflecting on what my state offers. And I live in the state of Utah, where having a family is part of the culture and identity out here for a lot of people. And I was blown away that the community didn't support a way for people to preserve a future family just because they had cancer. Mm-hmm. You know, we're always given accolades for people who survive cancer and they lead these incredible lives. But, you know, I don't think people really think about what people with cancer are really giving up outside of the treatment after they live their lives. So, because we have legislation now mandated from the federal government to cover a lot of things for breast cancer, it doesn't make sense that fertility preservation isn't rounded up in this. This affects the well-being. And so when I started learning beyond breast cancer, since I'm a young advocate there, that's where I started learning about legislation that affected people with cancer and specifically to breast cancer. And you guys know we're all in the same class, that there are people there who have been diagnosed at a really young age. And it's always surprising, even though I feel like I was diagnosed at a young age at 31, I'm always really surprised when people are in their 20s or under 25. And it's like, who even was thinking about families at that time?
Exactly.
In my experience, that wasn't me. You know, I didn't start having kids until I was in my 30s. So I'm sorry, I got diagnosed at 33. But so this really spoke to me, and I thought there has to be something that can be done. And luckily there is some legislation in some states that cover fertility preservation and cover infertility treatment options, or require insurance to cover those. But in my state, neither of those are covered. And I just think we're really doing a disservice. There's tons of studies that show that being able to preserve that part of yourself, or given an option to maybe have a future family, can help with the well-being of the person who's affected with cancer. It can help with recovery, knowing that there's something kind of at the end of the light, that not everything has been stripped away from you, and those types of things. So that's where, like, I kind of felt there was a need, and I really wanted to get involved.
That's awesome. So, Dr. Jones, the latest research has shown, and I mean, for years, people thought that pregnancy after breast cancer would increase your chances of recurrence. But the latest research has shown that that's not the case. But what about IVF? Can women that have had hormone receptive breast cancer safely do rounds of IVF after beating breast cancer?
They definitely can. The only barrier to doing it after chemotherapy is just not knowing how someone's ovaries are going to respond after being exposed. So as far as so the process of IVF, just for anyone who's watching that is unfamiliar, is we give women hormone injections to stimulate their ovaries to produce multiple eggs that are then harvested during a retrieval. To do that, we give them the medications that are secreted from the pituitary gland, and then the ovaries produce a lot of estrogen. So if estrogen stimulates the cancer, of course, someone would be very cautious about, now that I'm cancer free or done with chemo, giving myself the very thing that probably led to my hormone sensitive cancer in the first place. So in women who have hormone-sensitive breast cancer, we definitely use adjuvants like letrozole that keep the estrogen levels very low during the stimulation. And a stimulation is generally 2 weeks long. And then you go back on a medication that will keep your estrogen levels low. So it definitely is a conversation to have, not just with your fertility doctor, but to bring in the med oncologist and the breast surgeon, and to really have like a team around you to make the best decision for you, because cancers are not all the same, even when they're hormone sensitive. And in all of this, what we all want is to have the patient be there for their life. So we don't want to do anything, but generally a 2-week stimulation is fine.
That is good.
So, Natalia, a lot of people look at the state of healthcare and just see a lot of problems, but you saw an opportunity to make a difference. I know you talked a little bit, before why it inspired you, but what else is one of the reasons why you decided to do it? Did you hear from other young women like yourself that were saying that they wanted to know about this?
I did. Now, knowing more people with breast cancer, I have met women who have been able to do fertility preservation and women who haven't. And a few women now that I know who are done with active treatment are going through getting their eggs, getting embryos out of them and trying to get pregnant now, or just talking to women who are having a hard time dealing with not being able to, the idea of not being able to carry a baby has been really frustrating for them, especially women who have to make that decision because they're like BRCA positive. Yeah. So they have to get their ovaries or get a hysterectomy or get their ovaries removed. So it's been really interesting. And just a little background. So I'm like a policy nut. I have a master's in public administration. So the policy aspect of this was really interesting to me too, about how we can use our government to kind of make an impact on this need and for these people who really need it. It's a big compromise I think people have to do for cancer, and when you get diagnosed with cancer, and at least the research what I'm finding and what the states that are offering it, the impact financially is minimal, especially for this niche group of people who've had cancer and are trying to preserve their genetic material before they start cancer treatment. It's a really narrow scope, but it has a huge impact. So that's kind of where my two worlds kind of collided together, something I was experiencing with my background from school. So
that's really cool. Now, Dr. Jones, Natalia just mentioned something about the idea of trying to freeze or harvest eggs before you start treatment. Are there options for women to try to do that after they've gone through chemotherapy?
Yeah, there is, especially after a conversation with the med oncologist about, where the cancer is and are you in remission, just where you are in your therapy, and then seeing how your ovaries have rebounded after being exposed to chemo. So yes.
That is awesome.
And then Natalia, if there are other women who are interested in joining, with you advocating, or just even if they don't live in the same state as you, if they wanted to get on board and do some of the advocating that you are doing to get the fertility covered by their health insurance, what would you suggest that they can do?
I think the biggest thing that they can do that would have the most impact is calling their local legislators. And I'm not talking about people who are the senators and congresspersons of their state, but on their local government. Wherever you live, you're represented by usually a congressional person and a senator for your state based off of the district you live in. And either calling them or sending an email, either asking for a face-to-face appointment or even just informational is a good start. Most states also have infertility or fertility organizations within your state, and partnering up with them can also help you find a way how you can advocate through either an organization or kind of jump on board of what they're doing as well. So I would say those are the two things, and just like spread the word. It feels silly to me that having cancer, and at the beginning, I wasn't even aware of the situation, and now I am. Mm-hmm. It just kind of shows how people think differently if that is not affecting them personally.
Absolutely.
And so without knowing that this is an issue, no one else will know. So right now, what we're doing here, I'm partnering with an infertility group out here called Utah Infertility Resource Center, as well as with my sister-in-law, who has been lobbying in the past for a firm. And we've just been kind of meeting legislators now, and we're trying to start something a little more grassroots, and hopefully by the end, in the next few months, get our own nonprofit going, just because politics in Utah, they're very skeptical of outside of national, but there are really good national organizations that are leading headway and providing a ton of resources for infertility treatment and for fertility preservation. And one of them is Resolve. Mm-hmm. And they give really great information. There's a way to either donate to their foundation or to the organization, or even find a way how to volunteer with them as well. And then,
oh no,
Did she was getting, yeah, like she was getting good into it.
Yeah.
She's back.
Sorry. We're talking about Resolve.
Yes, sorry. So Resolve is a good organization to look into. I know our neighboring state, Arizona, has had a lot of support from Resolve that helped them implement some studies about what it would cost insurance to cover infertility and fertility preservation. And they estimate, this is an approximation that I'm remembering, but it would cost like $1.37 per insurer each month to allow the state to cover infertility and fertility preservation for the entire state.
That's insane.
So it is crazy. I mean, if I had to give up $1.37 of each of my paychecks and help people, I'd do it. My kids get Chick-fil-A like 3 times a week. I could that is just such a minimal cost, where I think that a lot of legislators and the insurance company might want you to think that the costs will go up, will skyrocket, and will just have a negative impact amongst people who are insured. And I don't think that's true. And so getting involved with one of those organizations, even to find out information and then start spreading it, is a good way to start advocating for any type of preservation or infertility treatment in your state.
That is awesome, Natalia. We're so proud of you, by the way.
Yeah, right. First of all, can I just side bust and say that this webinar has been amazing. And I'm here asking tons of questions, and I'm on Instagram, like, everyone get on right now. Like, it's been amazing. And what Jasmine and Marissa have been doing has blown me away since knowing you guys from where you started into now. Like, I cannot believe how many people you're helping and the representation is amazing. I mean, you're asking the questions that we normally couldn't get answers to because of our demographic, right? So anyways, you guys are awesome. And I think this is fantastic.
Thank you.
Thanks, Boo. We're not done yet. I have
Outdooring. I'm still
one
here.
more question, really, I'm thinking of for Dr. Jones. And this was a big one for me. Even I was pretty much still a newlywed when I was diagnosed with breast cancer. I was diagnosed at 26, like 2 months after my 2-year wedding anniversary. And then first of all, cancer is a big thing no matter how old you are, but for young people and a new marriage, it was a huge hit. And then we were asked, do you want to freeze embryos or do you want to freeze eggs? What kinds of things should women be thinking about? That's a big decision. You only have one round. What kind of things should women be thinking about when they're trying to make that decision?
So it's so funny because, in training, I would see people counseled in different ways. And I think it harkens back to kind of your gender, who's telling you the information, and then what their experience has been in life thus far. So I am an African-American female, so we know how it is out here. I definitely, if you're in a very stable relationship and, sometimes you don't even know what that means until things get tough. Freezing embryos and freezing eggs, I consider to be pretty equivocal. Yes, when you freeze and thaw eggs, you might lose some. There's like an 80% thaw rate. So if you freeze 10 eggs, you might get 8 back. But it does not mean that you're not going to be able to have embryos from those frozen eggs. If I make embryos, I might have gotten 10 eggs and I might have had 2 embryos. And then you freeze them. And then the freeze thaw rates are high. They're like 98%. So it's unlikely that you lose them and you know what you have. But just last week, in the Arizona Supreme Court, a woman that was diagnosed with breast cancer, she got a divorce and her husband did not want her to use those embryos. That was her one chance to use the genetic material that was linked to her. And the Supreme Court favored him and said she can't use those embryos. Wow. So in my background, I'm not even surprised because relationships can fall apart. But when you make an embryo, it belongs to 2 people, not just one, unless the paperwork, when you sign it, one person has said, if something happens, I want this person to have it. And if that's going to be the plan, I'm all for it. But if it's not going to be the plan, I would rather have my genetic material. So I'm the only one who has to say what happens, right? Even if it's a marriage, even if it's, and I think they were actually boyfriend and girlfriend at the time where, like some doctor might've just been like, okay. And I would have been like, step aside real quick. Let's just, this is your one shot, because sometimes, as your head is spinning, and that's what I'm saying, you need, you got to take the white coat off and just like come back to real life, let me walk you through the things that might happen. And then you have to understand you still get to make a decision, but you make a more informed decision because you can see I've seen, I'm not that old, but I'm old enough to have seen some things. And I can just tell you what those things are. Now you have a clearer picture and you can then choose what you do. I am a very big proponent of women freezing eggs, just to keep it safe. And even if you do some embryos and some eggs, you can do that, and unfortunately, a lot of times you can't do more than one IVF cycle or egg vitrification cycle. So it's a hard choice, but I think eggs are very valuable. Yes, you might not have any embryos after thawing them, but that might have likely been the case in the first place if you would have just made them. So I get really cautious with young people freezing embryos, especially if they're not married, and even if they are married, just because I've seen things. The other thing that is newer is, and still in experimental, which I hope comes to the mainstream soon, is ovarian tissue cryopreservation, which is a surgery that removes some of the tissue from an ovary and freezes it. So instead of 20 eggs, you can have thousands of eggs, and that without any hormonal stimulation and things like that. And either it can be implanted later, or it's that's something that's being investigated now and could really, change the game as far as avoiding hormonal stimulation, at least in the most sensitive time before it. Because when people do this, their cancer is still usually inside of them.
Exactly.
Like it's not, you haven't had surgery. You may have not even had your PET scan yet to be staged. So, so these are very, it's a very quick decision to make. But if the question is like eggs, embryos, what should you do? It's a personal choice between a couple. My stance, no matter how strong your relationship is, there's really at the baseline half and half if you can.
Mm-hmm. You know what's interesting? I think that is an absolute great point. I will say in my paperwork, I did have my husband sign off that the embryos would come to me. Because what could happen is if you have a divorce, is they can go on and have children with somebody else.
Mm-hmm.
Yeah, so I did have that put into our paperwork. But what's interesting? They never even offered me the opportunity to do half and half. And I responded extremely well. We harvested 36 eggs.
Wow. Yeah.
And it was so uncomfortable.
I bet. Yeah. And sometimes, and I'm not sure how many embryos you have, but sometimes then we get into the thing where you have way too many embryos that you're going to need. And, so it's just, there's a lot of, I find in medicine where we're doing a disservice is we don't have enough time with our patients, especially with these delicate things, this cancer is a whirlwind, fertility preservation counseling. It's a world, you never even heard of IVF. You wasn't even thinking about doing IVF. And I have to break all these things down in such a short amount of time. So, I really, I think that's where we can do better as physicians to give more time, more counseling.
Absolutely. Yeah. Well, ladies, it has been a pleasure talking to you the last 30 minutes. Thank you so much, Natalia and Dr. Jones, for spending
Thank you.
Again, guys, if you have any questions, please leave them in the comments or send them in an email to us at hello@breastofus.com. And we're getting ready to wind it down, guys. So let's shout out to all of our partners tonight and all of our speakers tonight. We really appreciate everyone that took the time to do this with us. Rissa, you want to plug our social, our handles?
Yes, if you are not following us already, well, most of you are on our Facebook because you are watching. So definitely go on ahead and shoot that out to all of your family members and your friends. Ask them to follow us. We are also on Instagram at forthebreastofus.com. Go on ahead and take a look over there and see some of the graphics and the beautiful pictures that we are posting of ladies of color. And we're also on Twitter, The Breast of Us. So definitely take a look at us over there. We're engaging in a lot of chats, and there's a lot of information that's over there that doesn't really get filtered over to Facebook and Instagram, like different clinical trials or different surgery options. There's a lot of providers that are actually on there too. So I would definitely say, even if you're not on Twitter, just go on ahead and, get you a profile, and then follow us, and then we'll kind of lead you on there. And then as well, definitely go check out the site if you have not. We are at breastofus.com. Read some of the amazing stories that our breast cancer baddies have written for us. They are all amazing. Some may make you cry, they'll laugh, you'll smile, but it is definitely a good platform just to see women of color talking about their experiences and their journeys within this breast cancer community and how we have all found each other. So definitely take a look at us over there. And if you have a story that you want to share, whatever kind of story it is, you could talk about finances during and after breast cancer. You could talk about raising kids, being a single parent, anything and everything. Nothing is off of the table. If you would like to share your story with us, please, 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 please send us an email at hello@breastofus.com. And we would love to post your story or your blog on our website.
Well, that is it for us tonight. We appreciate everyone that took the time to tune in. Marissa, we have like a screenshot or something for our first webinar. Hang on.
Yes. Are you going to get it?
I got what? Say cheese. Got it.
I gotta do the peace signs. You guys know. You know me.
Thank you guys so much for tuning in. And this is the first of many webinars that we're going to be doing with you guys. We have some special things in the work this year.
Yes.
And that's it. Breast Cancer Baddies out. See you later.
Bye, guys.